the relationship with sleep and women. Okay, women premenopausally have hormones which help to protect us from airway collapse. Now, as a species, a part of our species, women are the protectors of the species. So we are somewhat, in general, on a little bit higher sympathetic alert. That means our awareness of the environment is a little bit higher than for men in general. And if our airway is under threat, our airway we have little sensors in our airway which detect that the airway is under threat. And if they detect that the airway is under threat, in other words, you've gone off to sleep and the jaw is starting to fall back as a part of that process, those little receptors detect that it's harder to get the air from outside into the lungs. And they will disrupt the sleep. They will actually send a signal to the brain, you had better wake up or your airway is going to collapse. And very commonly in women, this is going on. But if they go and have a sleep study, they don't have a full collapse of their airway. So they'll come out with an obstructive sleep apnea index of less than 5, 1 or something like that. So say, no, there's no obstructive sleep apnea. And that's true, because to have obstructive sleep apnea, you have to have a full collapse of the airway or enough that it's causing, blood oxygen drops and things like that. If your mechanoreceptors that are in our upper airway are on such high alert that they're not allowing that airway to collapse, but they're causing an arousal, that sleep fragmentation is now very, very disruptive to the process and the work of sleep. We need sleep, and we need it to be a very good quality sleep. We all eat, but what is the quality of our food? We all exercise to some degree, but what is the quality of that exercise? If all it is walking from the fridge to the couch, that's very different to somebody who goes to the gym. If you go to sleep at night, we all sleep. Everybody sleeps. Even people who don't think they sleep actually fall asleep at some point in time. But what is the quality of that sleep? If the work of sleep is getting interrupted every couple of minutes because there's a threat in your airway, a threat that it might collapse, and you rouse so that you breathe normally and you don't allow that collapse, that sleep fragmentation is totally going to destroy the quality of your sleep. And this is what I find with so many of my TMD and my chronic pain patients. They are having disrupted sleep, but they don't necessarily have full-blown obstructive sleep apnea. They often have a thing called upper airway resistance syndrome. And they're very highly symptomatic patients, and it can be an irritability, it can be crankiness, it can be brain fog, it can be just not a clarity of thought, it can be, road rage type scenarios, just different, you're on your last nerve all the time. You get personality changes happening, like this is not the person I married. And it might be that, maybe the work of sleep, that restorative aspect, is not happening for this human being. So it's incredibly important that we find out if that's what underlying the problem. So many people go on medications for these things. They go on sleeping tablets because they're having insomnia. And insomnia is one of the big symptoms of this upper airway resistance syndrome. It's almost like a fear of going off to sleep, or those arousals that are happening during the night. You wake up at 2 a.m. and you cannot get back to sleep because you're on such high sympathetic alert. You have to be in a parasympathetic, calming, it's all good state to sleep and to maintain your sleep. So that can be a very significant problem for patients. Now, this is more common in women than it is in men, but it also happens in men. But you'll frequently get men, their upper airway receptors just blunted and they go straight into full-blown obstructive sleep apnea. For women, once they hit menopause, we do not have those protective hormones anymore, which are also making us on more high alert. So you'd have women who then go and maybe put on a few kilos on as well around the menopausal time, and suddenly their upper airway resistance actually goes over into full-blown obstructive sleep apnea. So that can happen as well. And that's something that menopausal women need to look out for. If you're pregnant, snoring is a big no-no. very, very bad. You have to, you've got a higher risk of a low birth weight baby and a preterm baby if you're snoring. You've got a higher risk of developing preeclampsia, which is a life-threatening condition for mother and baby, if you're snoring. So snoring is not okay. Snoring is a sign of increased resistance to the air from coming out here into your lungs, and it's a struggle, and you're going to have your sleep disrupted. And you're also potentially creating a hypoxic situation for your baby, where you've got lower blood oxygen. So it's extremely important that women look at sleep and make sure that the quality is there.